Welcome back. Well, this afternoon we're talking about women's heart health. In fact, Go Red Day is February 1st. It's a day to wear red and bring awareness to the importance of heart health, especially for women. With me right now is Dr. Anu Rao. She's a cardiologist at the Cardiovascular Associates affiliated with Brookwood Baptist. Talking about women's heart health. So I know in the commercial break, or going to commercial break, we were talking about some risk factors that women have that men don't necessarily need to be concerned about. Is that correct?
So women might have more than men. So we traditionally think of the traditional risk factors like smoking, diabetes, high blood pressure, high cholesterol, physical inactivity. But we know there's some novel risk factors like rheumatoid arthritis, lupus, depression. These are things that women are more likely to have. And so sometimes we don't think of those, perhaps even younger women, at risk for heart disease. But if they have any of those things, their risk needs to be assessed. And if they have any symptoms that might be their heart, that needs to be taken very seriously.
You mentioned the ones you mentioned are the risk factors that you kind of think about, but you mentioned depression. How are depression and heart issues, how are they connected?
That's a great question. So I don't think we know exactly how, but depression can be associated with not taking care of yourself, higher blood pressure, or just increase in your stress hormones. So long term, it might cause your blood pressure to be up, your cholesterol might not be normal, and those things can result in issues. We also know extreme stress can directly affect the heart.
So this month, in a few weeks, I can't believe it's already February, a few days, we'll be in Women's Heart Health Month. So what are some things that women, especially and people, men who are always around women, should be looking out for or paying attention to be more aware, especially this month?
So I think we've talked about women and heart disease over the years. One thing we're seeing is that young women who have heart disease are more likely to go unrecognized than their male counterparts. Now, there are a smaller number. Young women are less likely to have heart disease, but the ones that have it are being missed sometimes. And we now know there's something else where young women having heart attacks may not block up the blood vessel. They may actually tear, and the blood clot forms under the surface. And so they may go to the emergency room with typical symptoms. They may even have an angiogram, and things might look okay, but they're not. Under the surface, they may not be. And even if they do have what appears to be a blockage, in some cases it shouldn't be treated the way it is routinely.
Okay, so this is just a time to really pay attention to your overall health as a woman, but specifically your heart health, because as you mentioned, a lot of factors can contribute to heart health issues.
Take all symptoms seriously.
All right, well, thank you so much, doctor. We appreciate it.